Hello and welcome. Well, during winter, it is commonplace that parents are concerned about the health and well-being of their children due to the spread of colds, flus, and viruses. 2020, however, has presented an exceptional set of circumstances collectively for everyone, as COVID-19 has created an exceptional amount of heightened worries and concerns. So the question is, do you know what the difference is between the common cold and COVID-19? And if your answer is no, then tune in. This interview is definitely for you. To help explain this to us today, we welcome our special guest, Dr Nelu, a paediatric doctor with over 10 years experience. Now, Dr Nelu is here today to create awareness and to explain the difference between the common cold and COVID, something we all really need to know and understand, and also to provide education around common questions you may have and to provide a credible, relatable and accessible source of information to the public on this critical topic. Thank you for joining us today. Welcome. How are you?
Very good. Thanks for having me.
This is wonderful. And as we were just saying, this is something this time of year, more so than ever, that we really need to understand the difference between this. And it's been said before that you have a love for educating parents and patients about common health concerns. But COVID-19 is just a little more than just the common health concern, as we have sort of found out in recent months. So I'd love to understand from your perspective, what are the common concerns that you have found families are having during this time?
Yeah, look, this has been a really unprecedented time for everyone, and I guess it's probably like nothing any of us have been through in our lifetime. So it's quite an interesting time for the general public, for doctors, for parents, for everyone. Look, there's a lot of concerns, and I think a lot of the concerns come from what we're seeing overseas as well. And I think it's important to remember that what we're going through in Australia is quite different. Our rate of transmission and rate of deaths is much, much lower than overseas. And although things are ramping up in Victoria at the moment, we're really in a very lucky state to be in Australia.
Yes, agreed.
So I think a lot of the concerns are coming from that and the numbers that we're seeing overseas. Parents are worried about, what if my child gets COVID-19? What does it look like if they have it? What are the effects if they get it, etc. So there's a lot of concerns out there, and I'm happy to go through some of them.
Okay, wonderful. Now, to start with, we published your article and the title is Understanding the Difference Between the Common Cold and COVID-19 in Parents and Children. Now, for someone who hasn't read the article yet, can you please give us an overview of what it's about and just tell us what inspired you to write it?
Yeah, well, I was approached by Kiddipedia to write something on this topic because obviously it's something that's very important and relevant at the moment. So I'm really glad that I had a chance to do that. The article really goes into what is a common cold and what is the coronavirus. And really the tricky thing that there isn't much of a difference, which is what's making this all very confusing at the moment. And I also discuss what the treatments are, in that it's generally supportive, which means that there isn't really much in the way of treatment, which is the same with all viruses, and what sort of groups of children are more susceptible, and also what parents can do to help reduce the spread as best they can at home, and to also just bring up these questions with the kids and use it as an educational opportunity as well.
Wonderful. And you've mentioned in the article that coronavirus is the name for a family of viruses. And some coronavirus strains we have known about for years and are harmless. However, COVID-19 is the new circulating strain that can cause serious disease in humans. So initially, what is the difference between coronavirus and other common viruses?
Yeah, so look, there are hundreds and thousands of viruses that circulate. And every year, particularly in winter, we see children with any number of those viruses, which I say is harmless, but I mean, any illness can be harmful in any capacity in anyone really. But what we see come through emergency doors is generally what we call a common cold, which can be anything from a sore throat, red ears, headache, body aches, vomiting, diarrhea. All these viruses can cause any host of those symptoms. And there's about 10 or so that we test for routinely, not in every child with the virus, but in specific groups of children. And then apart from that, there are hundreds and hundreds more that we rarely test for. We don't really need to know exactly what it is because we know the way that these common viruses behave. Coronaviruses are a family of viruses, and there are some that we've known about for years that do cause fairly benign cough, cold, runny nose, fever illnesses. And we know that sometimes children who are either really young, so really young babies, children who have other medical problems or who are on immune suppression medication, for example, can get quite sick with these viruses. But the vast majority of children are pretty well enough to be at home with fluids and pain relief, and they can manage the virus at home.
Mm-hmm.
Coronavirus, as far as we've seen in the current COVID-19 SARS virus that we're seeing circulating, is generally more mild in children. So it does cause a bit of a common cold type picture. I keep saying, doing that in inverted commas, because there isn't really a common cold virus per se. So the current COVID-19 does cause this very similar picture in children. The tricky thing with that is it can also cause other side effects that we're seeing mostly overseas. We haven't seen that here because we're not getting the same numbers as we are overseas.
Mm-hmm.
And this current one is causing a lot of severe illness and death, unfortunately, in the older population.
Mm-hmm.
So although it is a bit like a usual virus, there's that other complications that we're seeing.
Yes, and there are still a lot of unanswered questions, which is the biggest challenge for everyone at the moment. And with regards to children, I've read that the Mayo Clinic in the US has reported that although rare, infants under the age of 1 are at higher risk of severe illness from COVID-19, which, as you mentioned before, doesn't necessarily relate to school-aged children. But studies have also showed that newborns may be infected with the virus during childbirth or exposure to sick caregivers after delivery. Not so much here in Australia, as you've just alluded to, this is more so overseas, but it's just important for us to be aware of what is happening overseas here in Australia. And also older children who get the virus have symptoms that that tend to be mild and cold-like. And they sort of can recover within a week. So it is broad, depending on the age of the child and obviously on the strain. So I just wanted to ask in general, what are your thoughts on this?
Yeah, I think that's what's making this so confusing. You can have
Yes.
0 symptoms and be positive, or you can be really sick with it. So, and I think that's what's really confusing for parents and for health professionals as well.
Mm-hmm.
Suddenly we've gone from a winter where every snuffle is just put down to a simple virus, but now we need to think of every single snuffle as potentially being COVID.
That's it.
Not necessarily, yeah, not necessarily because the child will be super unwell, because we know that children in general have more of a mild illness, but we do know that the spread of it to the older population or those with other medical problems, it can make them really quite sick. And we're just
Yes.
seeing more and more evidence of that coming up. So
Mm-hmm.
it's really hard to distinguish the difference between a coronavirus, COVID-19 illness and a regular virus.
Yes, and you've mentioned earlier in this chat that there's no common cold per se, that there are hundreds of viruses that can cause a whole host of different symptoms, from cough, red throat, runny nose, sore ears, vomiting, diarrhea, rash, and many other symptoms. So I'd love to know what COVID symptoms should parents look out for that would present differently than a common cold, flu, or virus then?
Well, that's the tricky thing. There isn't,
Yes.
they all overlap. So the most common symptoms of COVID-19 are runny nose, cough, sore throat. And then there's also fatigue as well in there. But honestly, so many viruses can give you those symptoms. So I think at the moment, we have to, just for the public health safety, we have to assume that any of those symptoms are COVID-19 until proven otherwise.
Mm-hmm. So for many parents with younger children, they have a runny nose, coughs. All of these things are constant throughout winter, as you've just mentioned. But if it's
Yeah.
a new cough or a new fever or a new sore throat, that they should maybe consider getting the child tested. Is that right?
Absolutely. I would say at this stage, just given particularly if you're in Victoria, given the situation at the moment, any cough, runny nose, sore throat, difficulty breathing, all of that should be tested really for COVID, more for the child's sake, but also for public health safety as well.
So this is particularly important for those living in places where community transmission is occurring, as you've mentioned, such as Victoria, and we've seen some numbers increasing in New South Wales recently too. But some children, particularly through winter, have an ongoing sniffle or cough, and one infection can really roll into the next too. So in this situation, then, is it one thing to watch out for worsening of fever and cough as well? This is another thing that parents should be sort of taking note of.
Yeah, absolutely. Look, like you said, it's not uncommon for a child to have a snotty nose for 50 weeks of the year. We see that a lot, especially with children in childcare. But like you said, anything new, absolutely any new respiratory type symptoms, so anything sort of head, throat, chest, I'd get that checked and consider that it could be COVID-19 until you've got a negative test.
And definitely if the symptoms are becoming worse, maybe don't hesitate to get tested then, would you say?
Yeah, absolutely. And I guess the other thing to remember is that just like with COVID-19 or with any illness, if a parent is worried about their child, they should always seek medical support. I don't think this situation should scare parents from going to emergency departments and going to see doctors, because regardless of COVID-19 or anything, if you're worried about your child, they need to be looked at.
Yes. So just to reiterate, the symptoms of COVID-19 include fever, cough, runny nose, sore throat, difficulty breathing, and fatigue. Symptoms obviously more so in adults. And in that instance, that may also include nausea and diarrhea. And confusingly, for some people, there may be no symptoms at all. So, and even more confusing, the hundreds of harmless everyday viruses that can cause all of these symptoms too is a crossover, and this is where many people are becoming confused. Is that right?
Yeah. Agree. And it's hard for parents, it's really hard for health professionals. But I think the safest thing at the moment, like I've said before, is to just assume it's COVID-19 until we know it's not.
Mm-hmm. And children's temperature can rise above 37.5 degrees for a multitude of different reasons. How do parents know when they should seek medical advice from a practitioner with regards to the increase of temperature rising in children?
Yeah, look, that's a really good question, because that's something that brings kids into emergency a lot. So we call a fever anything above 38. So, and you have to be a bit careful how you measure it as well. A lot of the forehead thermometers can be up to a degree off. So underarm or in the mouth is probably better. But yes, so temperature over 38 is what we'd call a fever. Ordinarily, I would say that a fever in itself, in a well child, doesn't necessarily need to be looked at unless there are other concerning features.
Mm-hmm.
But at the moment with the COVID situation, I'd say any child with a fever should, and especially if they've got respiratory symptoms, should have a COVID swab done. So I'd say any temperature above 38, particularly with the snotty nose, cough, sore throat, or difficulty breathing, should always be looked at. Alternatively, any child who doesn't have a fever and a parent's worried about should also be looked at. So I think it's important to not get hung up just on the number of the fever itself. A child with a temperature of 40 can have quite a simple viral tonsillitis and be okay enough to be managed at home, or a child with a temperature of 37 can be really sick. So I would never take a fever by itself to mean a child is really unwell or not. It's always in combination of other symptoms. How are they looking? How are they eating and drinking? Are they making wet nappies, passing urine? It's sort of in combination with everything. And we see a lot of families who come to emergency with a high fever and a really well, happy child that we're not as concerned about. And we see children who look really sick who don't have a fever at all. So it's really up to the parents' gut instinct on whether there's something else going on apart from just the number of the fever,
Mm-hmm.
if that makes sense.
Yes, absolutely. In general, is COVID dangerous in children then?
Look, what we're seeing is generally no. It's more the older population who get the really severe COVID-19 disease. But like I said, with the numbers overseas, we are definitely seeing children who do become quite sick with it, and have some other complications. We haven't quite seen it to that extent here, just purely because our numbers of infection in this age group is much, much lower than overseas. So in general, I'd say COVID-19 is much more mild in children. They can have anything from no symptoms to mild respiratory symptoms. We're not seeing the severe disease as much, but it is something that all paediatric doctors and paediatric hospitals, emergency centres are preparing for, just in case that does happen. The healthcare workforce is definitely preparing for children who potentially become unwell.
And with regards to transmitting the virus also, I've read that children transmit the virus the same way that adults do, which is through droplets when they sneeze or if they touch a surface and then touch their face. And especially in younger children, we all know that they don't like to wash their hands and that they like to be close to one another as well. So in a similar fashion, these droplets may be transmitted from one child to another. So I just wanted to know your thoughts on that in particular.
Yeah, look, I mean, anyone who's got kids knows that it's impossible to keep their hands to themselves and to not slobber on things and not touch things after they've slobbered on their hands. So transmission theoretically is really tricky in children. We haven't seen as much being transmitted from child to child as you would expect. And I think that's probably because of a lot of the isolation and social distancing that we've started quite early on here, which is why I think Australia has done really well.
Mm-hmm.
But yes, it's really hard to do that social distancing with children, particularly when they don't understand. When a child is old enough to say, wash your hands before you eat, that's one thing. But if they don't understand that, it's really tricky, which is why I think the social distancing, limiting public outings, limiting visitors, obviously following the local recommendations is really important, because with children, unless the parents force them to not go into those situations, there's no way that you can stop them from touching things.
Mm-hmm.
So that's where the social distancing really is important for children.
Great advice. And in your view, I'd love to know the answer to this question. Can viruses in general be treated, and can COVID be treated?
Yeah, so look, viruses, the vast majority of viruses cannot be treated. So antibiotics work to kill bacterial infections. We do have some antivirals for some viruses, but most of them can't. So most treatment that we do for viruses is what we call supportive. So if a child is dehydrated, we'd give them fluids. If they need some oxygen support, we'd give oxygen. But that's not really to treat the virus per se, it's to treat the side effects or the complications of the virus. COVID is much the same. So there's no antiviral to treat COVID. So if a child gets COVID and needs hospitalization, it'd be similar, sort of fluids or oxygen or breathing support. There are some medications that they're trialing here and there for more severe disease, but there's no treatment as such, which again is what's making this really difficult.
Mm-hmm. So all in all, parents really, just to be able to prevent their children or anyone in the family from getting COVID, is to adhere to social distancing. As we know, with young children, this is not easy. So parents should really be following isolation rules. Have children avoiding touching objects in public places, washing hands often and always before meals, and keeping commonly used areas around the home frequently cleaned, would you say?
Yeah, exactly. I mean, look, with childcare and schools and things, it is a bit trickier, and at some point it's up to the parents really to decide if they'd rather keep the child home or send them to childcare. Of course, it's hard to keep children home all the time in terms of work and lifestyle and things like that. So it's just really finding that balance. And
Yeah.
if you can keep the children home, that would be recommended. But otherwise, of course, children do need to go to childcare. Parents need to be able to get to work. So I completely understand that. And it's important just to question the childcares as well, just to make sure that they're trying to follow, they can't really distance as much in childcares, but just being really careful with hygiene and hand hygiene.
Mm-hmm.
And it's okay to ask those questions.
Yeah, I'll maybe expand on that in a little bit in just a moment. But I just wanted to ask initially, are there any other things that we can be doing to help, I guess, our general health? I've spoken to a lot of people in the last few months now, and a lot of them have mentioned about a balanced diet, keeping on top of background medical, underlying medical problems, ensuring that we have vaccines for children up to date, and being aware of immune boosting fads per se. But is there anything else besides this in particular that we really can be doing, and or just all of those things that we've just mentioned?
Yeah, look, that's a really good list. There are a lot of fads out there at the moment, and a lot of people are jumping on the immune boosting bandwagon. I think really the main thing is keeping up a balanced diet, making sure that you know with a balanced diet, generally you have enough of the vitamins and minerals that you need for a healthy functioning immune system, or supplementing vitamins and minerals if the child doesn't have a balanced diet for whatever reason. I think it's really important to keep on top of the background medical problems. I worry that at this stage, with a lot of telehealth and reduced contact with medical professionals, that children with background medical problems probably aren't being followed up as closely as they would have otherwise.
Mm-hmm.
So I think it's really important for parents to keep up diabetes medications, or even keeping up their immune suppression medications for various diseases, keeping up that medication and keeping up the health professional contact to stay on top of those background medical problems. Because not just for COVID-19, but for any infection that comes up, any child with background problems tends to be have a bit less reserve. So I think it's really important to keep on top of that, and adults as well. I might add, I know we're chatting about kids, but really important for adults to keep on top of all of their background medical problems around now as well.
And
Um,
ensuring, yeah, continue. Yep.
no, sorry, go ahead.
No, I was just going to say, and just ensuring, I guess, when children are out in public, just ensure that they're trying to avoid touching their eyes, their nose, and their mouth. With giving that, I know that we're speaking about COVID, but with picking up any other bugs or anything else, and teaching children how to cover their nose and mouth with a tissue when coughing and sneezing, and or into the elbow, and obviously using hand sanitizer is obviously a really big thing. Would you say
Yeah,
in
they're huge things.
general?
I'm glad you brought that up. Yeah, I forgot to mention that before, but absolutely. Hand hygiene in general is so important, not just for COVID-19, but for any virus really.
Yeah,
And I'm really glad that we're starting to think about this a bit more, because we might see less rates of other viruses as well if we
in the
keep this up.
future. Yeah.
Yeah.
And I guess it's really commonplace that children can spread bugs and pick up all kinds of, bugs and viruses whilst at preschool, and at school in general, as you were just mentioning. So in your view, what should parents be asking, I guess, the kindergarten, preschool, childcare centres, and maybe even primary and secondary schools about how they are protecting their children? What sort of questions should they be asking?
Yeah, look, I think it's important to be realistic. I mean,
Mm-hmm.
it's almost impossible to have a group of kids together, and especially the younger they are, to make sure they don't touch each other and touch things. But I guess it's just checking that there's regular cleaning of surfaces. If the children are old enough, making sure they're washing their hands before meal times. And it'd be good to know whether there's just some general education about hand hygiene. There's a lot of really fun videos about hand washing and things like that. So it'd be good to know that primary schools and childcares are trying to take on that education side of it as well, because it's a really important educational opportunity for children as well.
As well. So schools and daycare and kindergarten, preschool should have some strict protocols around frequent cleaning. They should be able to go over and above their standard regulations, would you say?
Yeah, absolutely. And I think it'd be fair enough for parents to check that the childcare workers and the teachers and whatnot are also being protected, and that they're also being responsible, that if there's someone's unwell, they won't come in, that they'll do strict isolation of anyone who's been in contact. And you want to make sure that there's clear communication between the parents and the childcare and school if there are any concerns about anyone having COVID-19.
Mm-hmm. And I just wanted to address the long-term biological effects of COVID-19 stress on children's future health and development. There have been many external stresses coming out from this pandemic that have left a lasting imprint on children's health around the world, not necessarily here in Australia, but their children's well-being that can link to stress and chronic health conditions in the future. And there's been different things, even like, for example, like parental stress, school closures, lower household income, loss of co-curricular activities. So I'd just love to know from your perspective, what advice do you have that can help parents support their children and adolescents just to thrive during this time with all these added things that they're adding, I guess, to stress and to the health and well-being of children?
Yeah, I'm really glad you brought that up because I think it's something that we don't talk about enough
Mhm.
with regards to COVID, because there are, of course, all of the health implications, but what about all the non-medical related implications of being in lockdown, of all of this uncertainty around the world? I'm sure that there's going to be increasing rates of mental health issues in teenagers and children after this. And like you said, the family stresses as well, in lower income in families, family violence, domestic violence, and I'm sure these things are going to surface the longer this continues. So I think it's really important for parents to just be aware of the non-cough, cold, fever related side effects of COVID that's currently going on, and just really keep that dialogue open where you can, especially with teenagers who might retreat a bit in this situation. But also that sort of younger age group that aren't quite old enough to understand why we need to be in lockdown, and those questions about why can't I go to a playground, or why can't I do this and why can't I do that. Just really trying to acknowledge that it's a difficult time for them and try to use this as an educational opportunity for them as well. There are a lot of resources online for parents to help them deal with how to talk to children about COVID-19. And I can send through some links as well to that if that would be helpful.
Mhm.
But I think it's important for parents to be aware that while it is very stressful for them to think about work and family and isolation and social distancing and whatnot, it is equally stressful for the children. And I think it's important to acknowledge that and just really talk about it.
Yes, and we've published a
And
few.
seek help early. Oh, sorry.
No, they continue. What were you saying?
Just seek help early. I know that medical and psychological support is looking a bit different at the moment because of COVID-19, but I think it's important to still make sure that you're accessing, whether it's through telehealth or Zoom psychological sessions or whatever it is, just to make sure that you're still seeking support. And for parents with themselves as well, if they're struggling with the partners, or just seeking family supports as well where possible.
Mm-hmm. And here at Kiddipedia, we've published over 100 articles, well and truly easily now, with regards to supporting families through COVID. But in particular, there's
Right.
been quite a few that have addressed the psychological side of COVID, and also how to speak to children about COVID. And equally, as you said,
Oh,
any
fantastic.
other
Yeah.
links that you've got would be just wonderful as well, so that we can put them in the show notes. But lastly, I've left the really serious and heavy question to last, which you've alluded to some of this stuff happening overseas. But there have been a lot of medical papers in the last few weeks highlighting multiple areas of the body aside from the respiratory system that can suffer long-term damage as a result of contracting COVID. And whilst I guess the coronavirus disease that has caused COVID-19 presents much milder symptoms, in most children under the age of 18, experts have warned that infants are more susceptible to COVID-19. I guess a sort of are more susceptible to it due to their less developed immune systems. And many parents have expressed concerns about the multi-system how do you say the word? Inflammatory syndrome in children, as a side effect that coronavirus can appear 3 to 4 weeks after a child has contracted the virus. So this particular syndrome, which is also known as MISC, MIS-C, can cause different parts of the body to become inflamed. I just wanted to ask, just initially, what's been your exposure and or understanding of this, more so in children overseas at the moment?
Yeah, look, the research is still being conducted and still being gathered. So I think the tricky thing is we don't really know for sure.
Hmm.
And the virus is behaving so differently in so many different people that it's really hard to get a clear pattern of it. But I think there is emerging evidence of multi-organ involvement, and that's through the blood vessels mostly. And we're seeing blood vessels are everywhere in the body. So although it presents primarily as a respiratory illness, I think there's mounting evidence that it can involve other body parts and other organs. We're not seeing as much of it here, again, as I've mentioned, just because of our numbers are so much lower. So we will be guided by the experience overseas. Um, I think it's tricky. My exposure has been very little because I've actually been on maternity leave since all of this started. So I haven't actually seen that many children with multi-organ involvement at all. But I think it's important for parents to just be aware of it. I wouldn't be, I would just take on the same degree of concern about their child, in terms of if they present with any sort of medical problem at all. Just go by the normal means, speak to the GP, go to emergency if you're concerned. Of course, the health professionals will always have COVID-19 in the back of their mind. And we're very lucky that we're very forthcoming with the testing here, and children will be tested for it if there are any concerns whatsoever. So I don't think there's cause to panic. I think parents should be concerned enough to be vigilant, to listen to the state advice and to seek support, but I don't think that they need to panic about
No,
everything
but,
that
but
pops up being COVID.
it's good for us maybe just to be aware of it more so at the moment, not
Oh,
to, yeah.
yeah, absolutely. Absolutely. I think at the moment, with the way that things are going, particularly in Victoria, almost anything that comes up medically that you're worried about with the child, you need to keep COVID in the back of our mind. So as long as we're keeping that in the back of our mind, but not being too concerned about it to the point that we're not leaving the house or doing anything. Sort of trying to find that balance of being concerned and being on the lookout without being too overly anxious about it. That would be really nice if we can try and find that balance.
Yes, and just to, I guess, finish on what the Mayo Clinic and what all the different research is finding about that MISC syndrome, but the
Yeah.
Mayo Clinic describes it as a serious condition which parts of the body, such as the heart, the blood vessels, the kidneys, the digestive system, the brain, the skin, and the eyes become inflamed. So just all in
Yeah.
all, I guess we shouldn't underestimate the seriousness of the COVID infection. As you just said, it's just more, it should be at the back of our minds. But pretty much it
Yeah.
seems like that COVID is like a nose to toes disease that can affect all different things, from a loss of smell all the way through our bodies to frostbite in our toes. And the number
Yeah.
of young people in ICU, definitely overseas, is on the rise. So I guess for many people, this represents a long-term scarring and disability with breathing and general health. So we want to avoid anyone at all obviously getting this, but in particular obviously children as well. This is something that they may live with for their entire lives, some of this scarring. So the condition is rare, as we know, in children, but some people have actually some medical professionals, and a lot of the reports in some cases have been mistaken with a Kawasaki disease and toxic shock syndrome, and that's how it's presented in children. Have you read anything or heard anything like that before?
Yeah, similar. That there is evidence of this occurring. Um, Kawasaki disease is something that we've seen long before COVID-19, and it's a very similar sort of illness. And I guess it's now, if we see a child that we would have ordinarily thought had Kawasaki disease, of course we'd think about COVID. But again, I think that's something that happens when a child is unwell enough to be seen by a medical professional. Then it's our role really to think about that. I think the parents' role is to just be on the lookout. If there's any symptoms, particularly respiratory, but anything else that they're worried about, just always seek the medical support that they would, and just be really, really, really alert about it, and just really vouch for your child as well, and to make sure that you're seeking the support that you need.
Mm-hmm.
I guess the other thing to mention, you mentioned briefly before, is the vaccinations. Just keeping up the routine vaccinations, because we know that flu, for example, influenza, can cause really serious illness in children, and we see much more flu-related ICU admissions than COVID-19. much, much more. So just keeping on top of those things as well is really important at this stage, because we're yet to see a child with the bad flu and COVID together. So we don't want to know what that does to your body. So
Yes.
and
And
make sure the vaccine preventable conditions we're staying on top of.
yeah, and I guess to further conclude, we should not be underestimating the seriousness of COVID infection, definitely in children. And if your child is showing symptoms, you might be tempted to think it's just a cough, but most of the time it will be just a cough, I guess. But
Yeah.
it's just for us to, I guess, just to have that early detection, and I guess applying other measures as you've mentioned before, such as physical distancing, staying home if unwell, hand hygiene. All of these things are absolutely critical for our response and keeping ourselves and
Yeah.
our families safe. Now, we've
Yeah.
touched on, oh, sorry, yeah, go.
I was just going to add, I mean, the other thing about it being just a cough in a child is that a child might have COVID-19 and get away with just a cough. But if that child gives it to their elderly grandparent, they could very much end up in ICU or worse. So although a child could be reasonably well with COVID-19, it's really important to make sure that we're keeping them away from other vulnerable populations, particularly the elderly.
Mm-hmm. Absolutely. We've covered a lot of information in this chat today. If you were to summarize your key messages for any parent watching or listening, what would they be?
So I'd say be concerned enough to follow advice, but not concerned enough to panic. That's probably my number one. Um, then also, any viral symptoms, consider that it's COVID until proven otherwise. So make sure that the child gets tested, and to follow the state rules very closely for social distancing and isolation. And just advocate for your child. You know your child the best. And if you're concerned about anything, whether it's COVID-19 related or not, you should always seek extra medical support.
Wonderful. And if parents have got any other questions for you and or want to reach out after they watch and or listen to this chat, whereabouts can they find you?
You can find me on Facebook, my Facebook page, Dr Nelu, or on Instagram, that's Dr_Nelu. I'm sure we'll give you all the links. But yeah, I'm generally fairly responsive to questions. I do have a newborn at the moment, so I'm trying to do it in between all of that. But yeah, very happy to be contacted on social media.
Wonderful. Thank you so much for your time today, and really look forward to the opportunity of having a chat in the not too distant future. Stay safe and speak soon. See you later.
Great, thanks, Rachel. See you.
All right, bye.